Hello. This presentation was put together by Kate, Chelsea, Savannah, and Hannah for Missouri State University's gerontology program, and today we'll be talking about preventing victimization in nursing homes. After completing this training, the trainees will be able to identify the different types of abuse, identify the prevalence of abuse, understand the impact abuse has on an individual, identify signs of abuse, and know methods to prevent abuse from occurring in nursing homes.
Before we can help those who have been affected by elder abuse in nursing homes, there needs to be more legal intervention by medical and law professionals. They need to do more studies and gather more data to figure out what exactly is happening and what we can do to best prevent it. Legal awareness is rising. There are laws that are already in place, and a working definition of victimization in nursing homes is necessary to improve these laws. But this can be challenging because there are so many different behaviors that can be considered abuse, and some people might not even know that what's happened to them or someone they love has been considered abuse. So, an interesting quote that I found states that previous definitions of elder abuse have focused towards viewing the older person as essentially dependent or vulnerable, thus ignoring the diversity of those who are abused. As we know, this is a stereotype of older adults, that they're just vulnerable and can't do anything for themselves. So thankfully, this view is changing, and I found a pretty good definition that encompasses everything that it needs to. So the infliction of physical, sexual, or emotional injury or harm, including financial exploitation by any person, firm, or corporation.
Being able to identify signs of abuse is of vital importance in nursing care facilities. There are many different types of abuse that older adults can fall victim to, including physical abuse, neglect, financial exploitation, emotional abuse, and sexual abuse. Many people only think of physical harm when talking about abuse. However, there are many different ways that a caregiver can abuse an older adult. Financial exploitation, emotional abuse, sexual abuse, and neglect are 4 other types that are just as detrimental to patient care and cause very real problems that need to be addressed and recognized.
In order to best help those who have been victimized in nursing homes, it's important to understand how often this issue occurs. So about 1 out of every 6 nursing home residents will become victims of abuse just within this next year. It's also reported that women are at higher risk than men. And I found 2 studies over nursing home abuse, and it states the first study from Community and District Nurses Association found that about 88% have encountered abuse, either of themselves or of someone they know. And the second study states that a high number of calls came from nursing homes reporting abuse. However, this is kind of troubling because there's only about 5% of individuals that live in nursing homes. So the data is very disproportionate. And sometimes it's even thrown out from studies, causing underrepresentation of the victims.
Impact of abuse. The abuse of elders in a nursing home can impact them more than in a physical manner. It tends to deal with more psychological, social, and financial effects. And these effects can stay with them for the rest of their lives if nothing is done to help them. For the first example, psychological impact. The abuse can lead to any type of mental illness, such as anxiety, depression, and eating disorder, and so on. There will be more signs of aggression and then an abrupt change in personality. Elders who have suffered from abuse have 300% higher risk of death than those who haven't. Due to this, with these impacts, their health can severely decline and lead to the risk of more illness or even death. And the psychological impact can vary from person to person. Next example, social impact. Victims of abuse will no longer feel safe at home. Their environment becomes scary and they feel like they can't be themselves in their own home. This will cause them to become less productive and anxious to be around their other fellow residents. Elderly citizens already have a high risk for depression in nursing home, and the abuse can intensify the feelings of isolation and sadness. Next example, financial impact. Programs were started to provide health care for the elderly dealing with abuse. This was because abuse amongst elders has become shockingly more aware. $5.3 billion is spent to provide health care to those who have suffered abuse. This is funded by tax dollars that is mainly for physical injuries, and psychological injuries may be even higher. Recovery costs can be very high when dealing with the physical and psychological effects.
Being able to recognize signs of abuse in healthcare facilities is of the utmost importance. Signs of physical abuse can come in the form of injuries like broken bones, bruises, sprains, and dislocations, or broken eyeglasses. Neglect can come in the form of unsanitary conditions like leaving patients to lay on soiled sheets or not bathing them, withholding meals and medications, and the presence of bed sores. Signs of sexual abuse can include unexplained STDs and infections, bruises in genital areas, unexplained vaginal bleeding, and anxiety around the caregiver. One major red flag to look for when speaking to older adults in these facilities is the caregiver refusing to allow patients to speak for themselves or be left alone.
The U.S. General Accountability Office found that 70% of state surveys missed significant deficiencies and 15% missed notice of actual harm or immediate jeopardy of nursing home residents. Abuse is not uncommon, yet much of it goes unnoticed. As our population continues to age, the issue of elder abuse will become even more pressing. Staff must take immediate action by implementing the appropriate preventative measures. Ways to reduce abuse include encouraging older adults in nursing homes to participate in community activities. Activities could include exercise classes, art classes, bingo nights, book clubs, etc. Church groups are also an extremely helpful way of getting older adults more socialized. In other words, help them stay in touch with things that have been important throughout their lives. A healthy and active lifestyle reduces chances of victimization in older adults and also lowers feelings of solitude, which leads me to my next point. It is critical to avoid isolating residents. Loneliness and depression often increase the likelihood of neglect. It is important to note that members of the LGBTQ community are more likely to lack social support networks and overall may be more susceptible to abuse. It is also important to be wary of individuals suffering from any form of abnormal cognitive decline, such as dementia, because they may be unable to advocate for themselves. Older adults with dementia are also less likely to be believed by staff or family members when reporting abuse. Finally, it is crucial that caregivers avoid becoming overburdened. Feeling overburdened may increase irritability and resentment towards residents and ultimately create a cycle of abuse. Employers should always apply a rigorous and thorough mental health screening and background check for all future staff. Candidates with any history of abuse should be avoided at all costs. Currently, 95% of all nursing home facilities are understaffed, which may lead to a more lenient hiring process. Staff should encourage frequent communication between a resident and his or her family. If the resident is unwilling or uncomfortable with reporting abuse to staff, they may be more likely to open up about it to family members or close friends. Most importantly, you should always report any suspicions or signs of abuse as quickly as possible. The earlier the neglect is reported, the less harm is caused on the resident.
If you or someone you know is suffering from abuse or neglect, two great resources to turn to are the Nursing Home Abuse Center, which is a national organization dedicated to protecting older adults from abuse in nursing homes. They offer free case reviews and an abundance of information on how to recognize signs of neglect. And Nursing Home Abuse Justice, which was founded by a group of concerned advocates who want the world to know everything there is to know about what really goes on in a loved one's nursing home. Their passion is to tell the stories of the broken and abused seniors. If you suspect abuse or neglect, you can also call the hotline at 1-800-392-0210 and make a difference.